I went to medical school actually thinking I was going to be a pediatrician. And then we got to the heart. And all of a sudden for me in that gross anatomy class, I just came alive and I learned every little detail of the heart. So I kind of actually felt like that was my calling, even in the very first semester of medical school. If I could have my way as a doctor, we would develop technology that would allow us to see into that patient's future and be able to detect risk factors that were going to cause that person to have a heart attack or develop heart failure long before it ever happened, and then be able to do something to change that course so that they never had that happen. My philosophy is really to let the patient make the decisions in terms of what kind of care they want, what kind of treatment they're going to have, and what kind of goals they have for the future. If I go in, get to know them and who they are and what their life is like, what their interests are, and then ask them, these are the options that we could do to help you. Which do you think is best for you? I think the odds are much better that they're going to take that recommendation and actually live it and do it, and I think the outcomes will be better in general. One of the patients that I remember the best, and I don't think I'll ever forget this gentleman, came in a few years ago with a heart attack. They brought him to the hospital, but his heart stopped on the way. So they took him into the emergency room, tried to resuscitate his heart. They called our team and we brought him up to the heart lab, the cath lab, where we went in and found that one of his arteries had blocked. The amazing miracle was that he walked out of the hospital, and every time I see this man, when he comes in for his annual checkup, it makes me stop and think that he got to be around to see his kids grow up, and it's kind of emotional for us because we're both the same age and we share a lot of common values and things, and I'll never forget this particular patient. I'm Kent Meredith. I'm an interventional cardiologist practicing at the Intermountain Healthcare Heart Institute.